We never know the joys, surprises, and challenges life will bring. Many of us here are drawn together because we know a person who has a chronic illness and are trying to learn as much as possible about treatment options. This is certainly our case, as my husband Scott and I are trying to educate ourselves about his options for a new kidney, and we, along with you, will be listening to what each of the speakers have to say today. My husband Scott, who became a Donate Life ambassador to increase our community's awareness of the importance of being an organ donor, will introduce our speakers. Scott?
Thank you all for coming. The schedule, we're going to have four speakers, and after the speakers, we're going to have a panel discussion. The speakers will be Dr. Darrol Joseff will be talking about our friends the kidneys. Dr. Lauren Wood will be talking about the medical evaluations that patients undergo as considering a kidney, donating a kidney. Ann Gray from the One Legacy Foundation will be talking about the need of living donors to help with the need for kidneys. Randy Weiss, who donated a kidney, will talk about his experiences. Once we're through with the speakers, we're going to have a panel discussion. Along with them, Reverend Washburn from the Cottage Hospital will also be here. And if you have questions, we'll have times for questions and answers.
So I give a lot of talks to medical residents and the doctors at the hospital. And usually they're more technical than this, but this is a great chance. This is Billy the Kidney, who's the mascot of the Indiana branch of the National Kidney Foundation. And that's the daughter of a rather famous nephrologist, Nathan Hellman, in Boston. And you may not be able to identify, but the vegetable that she's giving Billy the Kidney is a leek. So he called it, this picture, taking a leak. Now, the kidneys have captured our attention for a long time. This is a relief from the tomb of Tepanuk, which is an Egyptian person who passed away 4,500 years ago. And you may be able to notice that the hieroglyph for the kidneys is there, which indicates the funerary offerings of the fat around the kidneys for his death. And that's actually mentioned throughout the Bible. This is William Blake painting of the complaint of Job, where Job is saying that the physicians of the time were of no value and could not help his complaint that his kidneys were consumed. But this is what I like. 2,500 years ago, the kidneys were thought to be the seat of the emotions and the intellect. So this is what I pound into the medical residents. The organs of the body were created to perform 10 functions, among which is the function of the kidney to furnish the human being with thought, from the Talmud Barakot. So as you know, kidneys are a paired organ. They reside in the upper abdomen, usually about 4 to 6 inches deep from the back. They get about 20% of all the blood supplied that's pumped by the heart. They are predominantly an excretory organ. Every cell in our body has a function. The nerve cells transmit information, endocrine cells create hormones, muscle cells move, they get their nutrients, and they all throw out the trash. Those chemical byproducts will build up in the blood, and they're filtered by the kidneys. You can see the arborization of the blood vessels as the exterior of the kidneys reach for the blood flow. And you see this cortex and medulla. The cortex in particular, this outer segment, is where a lot of the filtering occurs. And if we hone in on one of these individual filtering units, of which we have about 1 million per kidney, you see this incredibly complex, wonderfully adept structure of leaky vessels, which allow filtration of these solutes and relevant toxins. And this fine interlaced structure of the podocytes of the cells. Now, how do we know if we have any kind of kidney trouble? Well, this is a comprehensive metabolic count. This is basically a blood test. And I would urge you all, we're all patients, to keep copies of anything that you ever get done. You can keep track of it much better than any organization or electronic health record. So here, the relative numbers, the relevant numbers are the urea, nitrogen, and the creatinine. These are surrogate measures of how well kidneys filter. And this is the GFR estimate, which is a calculation, and I'll explain that in a moment, and the other chemistries. So basically, from a tube of blood, the cells are spun down, and this looks only at the chemical components of the blood. Here is a urinalysis, and there should normally be no protein in the urine. Protein in the urine can cause low protein in the body, swelling in the feet, other problems. This represents kidney disease, and a lot of other things to look at. This is an ultrasound, which is a simple test where they put a sonar transducer. Many of you have had these. And it basically looks at the size and shape of the kidneys, can look for blockage, things like that. So this is a no radiation test. Now, these are the stages of kidney dysfunction. And the stages go from stage 1 through 5. 1 is relatively normal filtration. Stage 3, which is GFR of less than 60 milliliters per minute, about less than 60%, that constitutes the definition of chronic kidney disease. And anything less, and when people get down below about 15, 10 to 15, then we need to think about dialysis, kidney transplant. Now, one of the problems with creatinine, and this is a busy slide, but that eGFR, this is the equation that's used. And all it is it looks at the creatinine and it looks at the age of the patient. There's a fudge factor for if one's a woman and a fudge factor if one's an African American. Now, in general, males have more muscle mass, and because creatinine is related to muscle mass, males have a higher creatinine normally than women. And as the creatinine rises, the relative kidney function goes down. The big problem with measuring this is that among the normal range of creatinine, which is like 0.6 to 1.5, there's a tremendous decrement. This is in a male, this is in a female. Tremendous decrement. People can lose 50% of their kidney function and still be within the normal range. On the other hand, if my creatinine goes from 4 to 5, I've only lost maybe 3 or 4%. So this looks like a much more dramatic change when really it represents a small change. And here, where our measurement system is so insensitive, there can be a dramatic change. And this is what drives doctors crazy about looking at these numbers. And this basically describes this issue because creatinine comes from creatine, which is created by the muscles. So if a 40-year-old person, and these are MRIs through the thighs. So this is all muscle. So this person would have a much higher normal creatinine in the blood than, say, this person. And I won't use the O word, but this is a more aged person who is more sedentary. And this is why somebody who's 74 years old and has low muscle mass and has a creatinine of 2 or 3 may have much, much lower function than someone who has a creatinine of 1.5 and has good muscle mass. Does that make sense? So, we all lose function through the years with age, other illnesses, and I'll go into some of those causes. But ways to conserve kidney function if we have impairment. And fortunately, we're all given about 10 times more kidney function than we need. If there's an illness, injury, accident, something that impairs our kidney function, these are the things that we need to pay attention to. These are ways to conserve and protect the function that we have. So understand the structure and function of kidneys, understand the symptoms of renal insufficiency and warning signs. If my kidney function gets too low and the toxin level builds up, then I can become ill. And the way people feel ill is that they can feel weak, tired, sleepy in the daytime but can't sleep at night, nauseated, sometimes lose weight, sometimes lose muscle mass, sometimes get itchy. All of those symptoms, we've all had those things, and that doesn't necessarily mean that we need to start some kind of renal replacement therapy, but when those symptoms develop a life of their own, that's the time that's very important. And if that represents advanced kidney failure, then people need to start some type of replacement or transplant probably the day before those symptoms arise. People can control their dietary intake of protein, It's important to control blood pressure, glucose if someone's diabetic, and lipid levels. These things can help conserve kidney function. It's important to avoid basically every arthritis pill that's advertised, except for Tylenol and acetaminophen. All of the arthritis pills that are advertised, Advil, Metapren, Nuprin, Aleve, Naproxen, Naprosyn, Celebrex, all of those things work by blocking some of the prostaglandin systems which cause pain. Unfortunately, relatives of those prostaglandin systems also maintain blood flow to the kidneys. So if I'm blocking the pain version, I'm also blocking the circulation version. So it's better to avoid all those medicines. When someone orders a CAT scan for me or an MRI scan, I'll go in for the scan and some technician will come up and they say, we want to inject some stuff into your vein to make a better picture. If you have advanced kidney disease, you do not want to have that extra contrast material unless there's a life-threatening need. You say, well, my kidney function's low, and if the technician comes back and says, well, we know your kidney function's low, but you need this test to save your life, then it's something to do. You want likewise avoid gadolinium because it can cause problems in kidney insufficiency. You want to keep track. And because most medicines are eliminated by either the liver or the kidneys, certain usual medication dosages may be excessive if someone has low function. So it's important that anyone who prescribes knows that. Now, if kidney function continues to deteriorate to the point where people need some type of renal replacement therapy, dialysis, or transplantation, these are the typical diagnoses. A little more than half in the United States is caused by diabetes. Hypertension is attributed about a quarter. Glomerulonephritis and others might include accident, illness, severe sepsis injury, where I'm in the intensive care unit, where I've had some terrible medical problems. My kidneys are injured from that. As of 2009, there were about 520,000 patients in the United States who needed transplant or dialysis, and by now it's around 600,000. Thus, the need for this. Now, this is hemodialysis, which is a technology that's been around since the 1940s. Blood is passed through a machine and filtered. This substitutes for kidney function. Patients have this procedure 3 times a week, and this substitutes for kidney function. Another way to substitute for kidney function is peritoneal dialysis, where fluid is brought into the peritoneal space and taken out, and that actually filters chemicals from the blood. Here's a child doing it. I think that my youngest patient I had in concert with one of the children's hospitals was 9 years old, was able to do this while awaiting a transplant. So I want to thank you all for being here, and I want to thank First United Methodist Church, One Legacy, Donate Life, and Cottage Hospital for supporting all the people who made this happen, including Scott and Lisa Burns.